waiting for Reuben to put through the entire electronic system. Governor John Bel Edwards is here for a couple of seconds. Hey, Governor, welcome to Kiel. How you been?
Good morning. I'm doing well. Thank you very much. How are you?
I don't mean this tongue-in-cheek. I don't mean to be a smartass here. I apologize, and I mean this with total sincerity. How you sleeping?
About like you would expect. Not much and not well, but we're working hard, and I'm, I know we're gonna work through this. It's just we're not close enough to the end of the tunnel to see the daylight yet.
Yesterday, I saw you mention during your news conference that you're a little bit worried that Shreveport-Bossier, Caddo-Bossier could become the next hot spot. And that, boy, did I stand on my head then. Are you real concerned about that?
Yeah, you better believe it. So, it was just a week ago we had 13 cases in Caddo and 4 in Bossier. Today, it's 115 in Caddo and 32 in Bossier, and that's about where New Orleans and Jefferson parishes were respectively 10 days ago. So what should help is that the mitigation measures, the social distancing, the stay-at-home order, have been in effect for a longer period of time as your cases are developing. And so that should slow the rate of growth, but that's only going to happen to the extent that those measures are being complied with. And so we are really urging all of the people across Louisiana, but I know I'm talking to Northwest Louisiana principally right now with you all, to really do everything you can to abide by, comply with these social distancing measures that we put into place to slow the spread. We only have so much medical capacity in our state, and it varies by region. And what we can't do is we cannot put a surge demand all at one time on our healthcare delivery system because we just can't meet it. And so this is really important, and I'm asking people to look at those numbers and be as concerned as I am because we've got to slow that growth. And I know you've heard it called flatten the curve, but that's exactly what it is. We got to flatten the curve, extend the duration of this event so that we can deliver the health care that people are going to need. And by the way, we're surging all over the state, including in Caddo Parish and in Northwest Louisiana to meet the needs of the people. We've got LSU Health in Shreveport that's moving to bring 120 ICU beds online over the next 3 to 4 weeks, but a number of those beds are going to be available just in the next couple of days. Mm-hmm. So we're doing what we can do, but we do need some help, and of course, as always, I ask people to pray for the best possible outcome as well.
Governor, you probably have learned in the last 4 weeks or so more about respirators than you ever wanted to know. What is the number of respirators in the state? Are we short? Are we able to get any more, et cetera?
Well, ventilators, so we don't have as many as we need. We don't believe that this is going to be a problem in Northwest Louisiana in the short term. We hope it never becomes a problem, and if people will do what they need to do to slow the spread, we're going to be in better shape, obviously, than if they don't. But we are predicting, based on case growth in the New Orleans area, the percentage of positive cases who have to be hospitalized, and then within that group, the percentage that need an ICU bed and a ventilator, that we could be short of ventilators as early as April 2nd or 3rd. That's not too long from now. As you know, we're working really hard. We have requested 5,000 from the Strategic National Stockpile. We have not been granted any of those yet. We are re-urging that request. We are buying ventilators as best we can from various vendors, and we've got orders in with manufacturers directly with vendors. I think as of right now, we have received a grand total of 190 ventilators, and with about 6,000 on order, not counting the 5,000 we've requested from the National Stockpile. But Aaron and Robert, this is the challenge. Everybody in the world is looking for new ventilators. Every country, every state in the United States looking for ventilators. And so it's not like most disasters. Typically if we get a hurricane or a flood, There may be a couple of sister states joining us that get hit at the same time, but we have all sorts of states that will come to our rescue and send us people and send us resources and so forth. The federal government can focus on our needs. This public health emergency is totally unlike those natural disasters because everybody is looking for the same thing all at once. Ventilators, PPE, staffing, nurses and doctors and respiratory therapists and so forth. That's what makes this public health emergency so particularly challenging, but that also is why it makes it so important, critically important, that people do what they can do to slow the spread.
Getting a lot of questions from our listeners having to do with schools. April 13th was your original order. When and what will the status of school be after that date? When will a decision be made?
Well, the decision is going to be made as we approach April the 13th based on the facts on the ground. And Dr. Fauci said it exactly right. You can't pick a date, an arbitrary date on the calendar and say this is when something is going to happen because the virus is going to determine that. And until we know what's happening with respect to the spread, the case growth, and whether we're able to meet medical needs and so forth, we can't commit to a date certain. Obviously, we just like the president, we want to get things back open as quickly as possible, schools, businesses, and so forth. But we have to get through this situation. There is no opening our economy while we have people presenting themselves to a hospital that can't be treated, and we have people dying from this particular disease, COVID-19, because they can't get treatment. So we have to get on top of it first, and then we will look at this as things change. But I can't right now, Aaron, and I wish I could. I just can't look at the calendar and come up with a date certain and say, oh, yeah, I'm very confident that by such and such date, our schools are going to be back in session.
Governor, the pastor from the Baton Rouge area that goes on Dr. Phil yesterday to say he's going to continue to have services. There are others. I'm sure he's not alone. Your voice yesterday sounded frustrated with folks that are not heeding your order. Can you offer a message to these folks who are not staying the heck home?
Yeah, Aaron, I just, the sense of urgency is obviously picking up. Every day we get into this, and we haven't yet started to flatten the curve, obviously is a day where things become, just that much more urgent. And so the tone in my voice, I hope, was able to convey that yesterday. The simple fact of the matter is, Aaron, we're not going to enforce our way out of this. We have tens of thousands of businesses, 4.7 million people. We've got about 4,500 churches around the state. We need people to comply, to take this seriously. And we certainly need our leaders to do that, whether they're elected leaders, whether they're business leaders, faith leaders. And if we have faith leaders who are not doing it, then we need individuals to take it upon themselves and not go to those services. Look, this particular virus spreads much more easily and quickly than the flu. And it is new. We don't have vaccinations. There is not yet a therapeutic treatment for it. And so we know that the death rate is higher than the flu, for example. So we're asking people to really take this seriously and make sure that they're doing what they can to abide by the mitigation measures, the social distancing, the stay-at-home order, and that is especially true, I think, for leaders, and that's my appeal to the people of Louisiana.
Governor, speaking of social restraints, is your inclination right now to maintain the status quo, to tighten things? A lot of people are worried about curfew or asking about curfew, or have you seen the statements made last evening by Governor Cuomo in New York and maybe loosen things a little bit? What's on your mind?
Well, I can't even think about loosening things before we see the curve start to flatten. And look, we saw another country, South Korea, for example, because of their early testing, they were able to flatten the curve pretty quickly because of their testing capacity and their throughput. And they identified so many more individuals early on and got them into isolation. And it's when the curve flattened, they loosened restrictions and their cases spiked again. So we're watching the situation. We expect to receive either today or tomorrow additional guidance from the CDC that will be tailored to the particular situation on the ground. So the guidance that they put out will apply differently here than it will to some areas of the country, and we're waiting to get that. I can't know what we're going to do, but I can tell you I have no intentions in the short term of easing up on any restrictions. I also don't have any inclination right now to impose a curfew. We've allowed the various parishes to do that. Some of the municipalities have done it, not necessarily to slow the spread of the virus, although that might potentially be a beneficial impact of curfews. It's just as first responders start wearing thin, maybe you're going to have areas of the state where a big percentage of first responders are themselves in isolation or quarantine, and they just need a little relief. And so they might want to do a curfew so they can conserve those resources and not have to provide all the shifts that they would normally provide. And so that's why we've given them that flexibility on curfews.
Governor, one more question for you. And again, your voice was frustrated yesterday when you talked about, and all of us are, what can the average folk do to help? I know stay home good, but you have some other suggestions as well, right?
Yeah, well, first of all, I don't want to forget this. I believe in the power of prayer, so I'm asking those people who are like-minded and faithful people to pray. But really, it is about minimizing social contact. So think about it this way, Aaron. We know that people need to eat and need to be able to get drugs from the drugstore. They need to be able to go to the bank and get money, and they need to be able to get gas and so forth. And so these essential businesses are left open. But nobody should be making multiple trips every day to these places. Go out once every 3 or 4 days. Get what you need and come home. And understand that being a good neighbor, because we all know what it means to be a good neighbor, but in this particular public health emergency, it looks totally different. Normally, we would be going to see somebody, personally checking on them, bringing them food, visiting with them, and so forth. If you love your neighbor right now, don't do that. Call them, Skype with them, check on them with FaceTime or something like that. But this is so different than anything we've ever faced, and we need people to be patient. We need people to understand the seriousness of the situation, and then just make sure that they're doing everything that they can to slow the spread. Because my nightmare scenario, and look, I hate saying this because I know what images it conjures up in people's minds, but there is no reason why we can't become the next Italy, where we're unable to give health care to all the people who need it, and we start rationing health care, and we see people die simply because they can't get on a ventilator because we don't have an ICU bed for them. Now, I'm hoping, I'm praying that doesn't happen. We're working very hard to make sure it doesn't happen, but it can happen, and we need people in Louisiana to understand that, take this very, very seriously, and understand this is not a New Orleans or Jefferson Parish problem. This is a statewide problem. The case numbers are growing everywhere. All but just a handful of parishes have cases now, but I can assure you the virus is in every parish. The COVID-19, the disease, is in every parish. We just don't have the test results yet to show it. So that's what I'm asking the people to do, and I want to thank y'all for putting out information to the public. And I know that you all do that every single day, but I appreciate the work that y'all are doing to communicate, and then allowing me this morning to communicate with the people as well.
You bet, Governor, and back at you, to you and your staff. Thanks for everything you're doing. I know it's been long, hard days, and we hope everybody's well. Thank you, sir.
Thank you so much, Aaron. Robert.